Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 370,278 confirmed cases of COVID-19 in Canada and 114,746 cases in Ontario. Chatham-Kent has 487 cases, and Sarnia-Lambton has reported 407 cases. Michigan now has 350,021 cases, with 20,046 cases being in Detroit. Today, we are reporting 41 new cases of COVID-19 in Windsor and Essex County. Of the 41 new cases, 5 are close contacts of confirmed cases, 5 are local healthcare workers, 5 are community acquired, 1 is an agri-farm worker, and 25 are still being investigated by our staff. We have had 3,637 cases since March. 3,134 cases are now resolved, and 424 cases are active and being followed by our health unit. 16 people are currently in the hospital and 1 person is in ICU. Our community has lost 79 people to COVID. 54 deaths have occurred among residents in long-term care and retirement homes. There are currently 16 active outbreaks in Windsor and Essex County. 3 are in long-term care and retirement homes, 7 are in workplaces, 2 are in schools, 2 are deemed community outbreaks, and we have 2 hospitals in outbreaks. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit your close contacts to your household, the people that you live with. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. And wear a non-medical mask or face covering indoors, outdoors, if physical distancing cannot be maintained or if wearing a mask is required. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. Testing is available for COVID by appointment at selected pharmacies and assessment centres. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 2 assessment centres, Windsor Regional Hospital Olette Campus and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Over the weekend, we reported 89 cases in total, 63 cases on Saturday and 26 cases yesterday. In addition, we confirmed outbreak at Hotel Dieu Grace Healthcare and Windsor Regional Hospital. With the case counts increasing in Windsor-Essex and many outbreaks that we are dealing with, our public health resources are stretched to the maximum. As Teresa mentioned last week, we are looking at our services to redeploy more staff to support COVID work, but we still need your support. If you are living in Windsor-Essex, please take the following steps. Self-monitor yourself every day and stay home if you are sick. Limit number of your close contacts. Ideally, do not meet anyone unless for essential reasons such as providing support to select few who need it and they cannot do it on their own. Restricting all non-essential visits. Physical distancing at all times with anyone who do not live with you. Develop a plan in case any of you or your family member is diagnosed with COVID or start exhibiting symptoms suggestive of COVID. Think about an isolation plan, work plans, grocery plans, and any other needs if you or any of your family members need to isolate. Try and maintain a diary of all activities that you are doing, including a list of all individuals you are meeting to help public health identify possible source of acquisition and identify high-risk contacts for containing the disease and prevent any further transmission. Prepare a plan to notify your close contacts based on your diary of activities and list of all high-risk close contacts. If any of you develop symptoms or is identified as a close contact of a confirmed case in Windsor-Essex, do not wait for public health to get in touch with you. Please start implementing isolation plans for your family immediately. If you haven't got tested, go and get tested immediately and seek healthcare support as needed. Even while waiting for test results, avoid all high-risk settings as best as possible. When a case is confirmed, notify all close contacts, including workplace, school, others, while still waiting for public health to complete their investigation. Our team is trying its best to reach out to all cases and contacts in a timely manner, but with more active cases and outbreaks, it may take them longer than usual to contact you, and that is why it is important for you to develop a plan and implement a plan as soon as you are identified as a close contact or identified as a case. You must monitor your symptoms daily and seek healthcare support as needed, or call 911 in case of any emergency. If you are identified as a case, generally all your household members will be considered as high-risk close contacts, and nobody should leave home for any reason other than the medical concerns with permission from public health. This is a difficult time for all of us, and every decision we make has an impact that not only affects us, but it also affects our family and our community at large. As much as I want to share more happy news with you and to tell you that the risk of COVID in our community is low, I cannot. The risk of acquiring COVID in our community is increasing at a rapid rate, and we will continue to increase, and it will continue to increase unless we follow all the public health measures. The move to red zone by the provinces aim to reduce the risk in the region, but we cannot reduce the risk unless we follow the public health measures before the entire public health system and acute care healthcare system collapse completely. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Good morning. I'm just wondering, is there any information on, any additional information on the outbreaks at the two hospitals?
Well, we did talk about the number of cases that each of these hospitals have. So at Windsor Regional Hospital, they have right now 4 confirmed staff that are linked with the one particular floor, and with no obvious source of acquisition outside of this outside of the hospital environment. And further investigation is ongoing. So far to date, we do not have any evidence that the transmission spilled over to the patient population, but based on the information that we have, we do not have any other obvious source which linked them to the epidemiologically to one particular floor of the hospital, and that's why the outbreak was declared.
Are patients being tested at this point, and if so, how many patients have been tested?
So all the patients on that floor are tested, and there's a plan to do follow-up testing, I believe sometime this week, just to make sure that no one is incubating the virus. So there is at this point no risk identified to the patient population. Obviously, the hospital have a strong infection prevention and control practices in place to prevent any transmission to the patient population, and I think that's what we are hoping, that despite some of this transmission that may have happened between the staff, it would not result in any patient population, and ensuring that we have a good investigation going on, all the good practices are being followed, and to prevent any further risk to the community, it is important that we follow those measures very carefully and take all the right steps to contain it as quickly as possible.
Okay, I'm just confirming, so at this time, you're not aware of how transmission occurred within the hospital?
Well, the epidemiologically linked transmission happened. If you want to ask exactly that who came in close contact with who, there are a number of ways, there are a number of reasons that these staff can come together. They can provide care to the patient, and despite all those measures, sometimes those measures either steps are not followed, or sometimes a breach happens. So we do know that it happened at that setting. Specifically where, which area, it's clear that all these staff, they work on a specific floor. So we do know that, and I'm not sure when you're referring that we don't know how the transmission happened, specifically pinpointing how exactly it's happened, at what time, where. I'm sorry, I cannot answer that.
Okay, thank you.
Any questions from Blackburn?
Yes, good morning. You mentioned, I guess, that your services are pretty stretched to the max. Can you just maybe elaborate on that? Obviously, there's still lots of cases under investigation. I know you touched on this on Friday, but just maybe go over again what you're doing to hopefully kind of rearrange some staff to help with that.
So we will continue to have internal discussions about that, but we have accessed the support from the Ministry and Public Health Ontario, and that really is direct help with contact tracing. So they have mechanisms in place to assist us with the contact tracing. So our nurses continue to do the initial case calls, and through the help of Public Health Ontario and the Ministry. In fact, this week we'll be getting, a support staff from the Ministry, about 10 or 11 more people to help with the contact tracing part of it. So it's not only the cases that require work, but it's the contact, because many cases have many contacts. So we're reaching out to the Ministry as needed, and I think I said last week we are getting assistance with field epidemiologists to assist with some of the statistical epi work that is ongoing and is necessary for all of our outbreaks. But internally, we are looking again at our programs, and we'll make some determinations about moving people back into COVID.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. I know you've mentioned before that the school cases put a significant strain on the public health system, since even one case in a classroom requires so much management, considering how many people are involved in a cohort. Is there any point where the school strain would lead you, I don't know if you have the authority to do this, but to shut down schools more than just the ones experiencing an outbreak?
That's a good question, Taylor, and I think we are looking at that very carefully. Obviously, the school is something that's that falls under the Ministry of Education, and they do have lots of resources and lots of supports that they're providing to the school to ensure that they are safe. We have been in contact with our Ministry of Health as well as with our Ministry of Education colleagues every day on the school outbreaks at this time. And we are sharing all the details, the work that's been ongoing, and finding better ways to contain the outbreak, so that we can rescind the outbreak in a timely manner, and also to even look more broadly in terms of more broader implications in the community with the schools that are currently open, and what are some of the key policy consideration, IPAC consideration that we can put forward to keep our schools safe. Obviously, some of this conversation requires discussion at a higher level, and locally, if there is a significant enough risk, then just like we did with Begley, we declared the outbreak and we closed the school. If there is any need to do more, we will act locally. But at this time, thinking about the broader community and thinking about our school system, that is something that does require more data and more conversation with different levels of the ministry before any decision is made.
I'm wondering, because the acute care system, they do have the possibility of going back and shutting down non-essential elective procedures and things like that, like we saw in the beginning of the pandemic. But are there things still available that public health can shut down to alleviate strain on your part, alleviate strain on the public health system, or do you just have to deal with whatever comes your way with whatever you have available to you?
So, good question. So we do have the ability to cut down many of the other essential public health services as best as possible, but we also have to recognize that some services we cannot cancel. And some could be just based on the expertise that is needed to provide that care, and some is just much broader implication from the health protection perspective. So it doesn't matter. Yeah, we have COVID. We have to deal with that, irrespective of how many cases continue to increase. It puts a strain on us, and it may lead to delay in following up all those cases. But we have to do that. No one else is there to do it. Some of the other health protection or other infectious diseases, such as, let's say, take example of sexually transmitted diseases, any other type of infection that continues to spread TB in our community, we still need to follow up with them, because if we don't, then we will run into another outbreak of a different disease. So there are some services that we can try and cut down, but there are some services that we still have to maintain. But before going into the pandemic, and I think Teresa mentioned that before, the infectious disease prevention team is limited number of staff that have expertise in that. But over the pandemic, we built that capacity internally. We redeployed staff. We did as best as we can, and we know that our resources are very limited. Our health unit is one of the lowest funded health unit, lowest funded per capita basis in the province of Ontario. The staffing complement that we have here is not as many of the other larger health units have. As you can imagine, for the health unit of our size, I'm the only physician who is here, while many of the other health units have number of physicians working there. So there are some disadvantages from a resourcing perspective that we are dealing with, but our staff are dedicated and motivated, and under the leadership of Teresa to manage all these operations, it's a monumental task given what we are dealing with. Just by the case rates, roughly our case rates are similar to what the city of Toronto is dealing with. And you can imagine what kind of infrastructure, what kind of supports they have, and what kind of supports that we have here. So as much as I like to say that yes, we do have the ability to mobilize resources, but it's not much, and that's why we need some of these measures. And my messaging to the community today was aimed on taking some of that responsibility and providing some support to public health. That have a plan. Don't wait for public health to tell you to isolate and to do all of that, because the number of active cases, the number of contacts, it's increasing every day. So for the last 3 weeks, our case counts have consistently are close to, on an average, 40 or so cases every day. And every day you're not only trying to connect with 40 new people, but you're also trying to investigate 40 different type of incidents resulting from these 40 individuals, all their contacts that we need to reach out to. And then if any of these contacts or cases require further investigation, such as outbreak consideration or cluster investigation, or if they work in a hospital setting, if they work in a school setting, if they work in a long-term care home setting, it all requires more work, and it triggers more work for our public health inspectors, our epidemiologists. So there's a lot of work that is happening, and it is a significant strain overall. And as much as I want to explain more about it, but I think the bottom line is we are getting worse. And as I mentioned, that we definitely don't want to the entire public health system to collapse, or the acute care health system to collapse. And with the outbreak in the hospital, it is a significant strain in our community. We don't have that much option. We don't have like 3 or 4 hospitals in the region that can support all these redirection of patient. Declaring an outbreak at the hospital, it was not an easy decision because we recognize that it will have a huge impact with patient admission and transfers. But we want to make sure that despite all these resources challenges, we are not putting anyone at risk. The health and safety and health and well-being of all our community is critically important for us, and we don't want to take that decision lightly, and we want to support everyone, and we'll continue to do that, but we need everyone's support to follow those measures and follow some of those recommendations that we made today.
Thank you, Doctor. And Teresa, the 10 or 11 more people that you've announced that you'd be able to access today are the same roughly 11 people that you spoke about last week, in addition to the 6 case managers?
Yes. And we continue to use PHO, Public Health Ontario. They have a referral system for the contacts. So I'm not sure how many people they have, but so in a school cohort, like you were describing, if we have to release a cohort to go home, we follow up with each and every one of the cohorts because they're contacts, they're not cases, and each of the students. And so we have used Public Health Ontario to make those contacts, which have been very helpful. So we are using what's available to us, but you're correct. Those 11 are from the announced last week, so they actually start today.
Okay, thank you both.
Any questions from CTV?
Yes, good morning. Thanks for having me again. Dr. Ahmed, I'm just curious. I'm working on Filipino time this morning, so I'm not sure if this topic was brought up, but any fines come out of the protest over the weekend?
Our staff, I'm not sure. I don't think that our staff were out there, but we worked with Windsor Police, and obviously they are the enforcer of the law, and we understand their that they are working to get some of these interpretation and enforce those regulations. So to my understanding, I am not aware of anything, but I think that Windsor Police would be a better place to ask this question directly.
Okay, we'll touch base with them a little bit later on. Shifting gears, I'd like to talk about charities if you got a minute on that one. I know that the Salvation Army's Kettle Drive has had to shift gears. I'm wondering, I guess I'm asking on behalf of the Sparky's Toy Drive, because I know they rely on, toys and, that whole physical interaction when it comes to, receiving those toys. So does anything change with what they have going on right now? Like, how would they have to change things up heading into the red today?
Yeah, I'm thinking we didn't specifically talked about those type of drive, but we'll look into it, and maybe we can provide some guidance that how we can do it safely. At this time, we are definitely trying to minimize contacts between people and avoiding any type of activities that that brings people together. So we'll have to look into it and see how we can provide some specific guidance around that. But we recognize that many of these services, this is a time when a lot of charity, a lot of social work that is done to bring everyone together. This is normally a time of joy and celebration, but it's the unfortunate COVID pandemic that we are dealing with, and it is difficult for everyone who is struggling for various reasons. And I don't know what more to say, but we'll definitely try to provide our guidance as best as possible to keep the event as safe as possible for everyone.
Is there a time frame on that? Because I'm thinking, it is a time of giving, right? People do want to give, and I know that they have a drive-through set up, right? So would that drive-through be impacted, I guess, in terms of, how many people can be in a car, or how many toys you can give, or, and I guess these are things you have to think about in the next few days, right?
Yeah, well, I think I don't think that if any, again, some of these drive-through events cause some traffic congestion, and so maybe the police can provide some guidance around that. But other than that, in terms of number of people sitting in the car, there is no limits to that, as long as they're all part of the same family. Obviously, we don't want people to carpool together, so there is no limit on there. And I think there are a number of ways people can do these type of drive-through events with minimal contact, and some of these giving or picking up can happen safely, and we'll try our best to maybe put some messages together in the next couple of days. I want to say that, and because recognizing that there's a lot of work that's happening, but we'll try our best to provide some messaging around it.
All right, very good. Thank you. You got to keep the smiles on the kids' faces this Christmas, right? So, good luck moving forward on that one. Thank you.
Thanks.
Any questions from AM 800?
Yes, thank you. Good morning. I was just wondering, it sounds like a broken record, but I don't know that people are getting the message, because I can't think of a day recently where several of the new cases haven't been from close contact. So in your case in contact tracing and investigating, are you finding that this is from like gatherings at homes or families visiting each other, or what? Because, there have been just a lot of cases coming from close contact of a positive confirmed case.
Well, we do have a lot of outbreaks going on. So as you can imagine, as we have a case and an outbreak and we follow up with their close contacts, it would always be their household members. So depending on the case, so if it's in a school or in a workplace, then there are many contacts associated with the case based on the outbreak definition. So a lot of these close contacts that we're reporting are from cases that we're aware of that are associated with outbreaks. So it is, a lot of them are, they make complete sense, because if I'm a case and I have, several people that live with me, the likelihood of passing it on to them is very high, and they could become cases. And we know that transmission does occur in the household. So a lot of the cases the new cases that are, we say are close contacts of confirmed cases, we have a lot of outbreaks right now in our community. As I talked about today, in workplaces, schools, the community, the hospitals, like every case will have high-risk contacts, and if those high-risk contacts become cases, it all makes sense. So decreasing your number of contacts is what people need to do. And when it was asked earlier about what more can be done, I think the province moving into the red zone, they're trying to do their part to emphasize the importance of some of the recommendations and the necessary measures to get the cases down. But, the close contacts from our point of view are making sense because of all of our outbreaks.
Okay, so it's safe to say then that a lot of these people that are getting it from a close contact are probably self-isolating together and are in the same household. It's not like there's, a bunch of gatherings or parties and stuff like that going on where it's being contracted.
Yes, and I would say that's accurate, because any of the parties or anything that would be disclosed to us, we would probably let you know that, as we have in the past. But we're not seeing a lot of, I'm not hearing that these are related to parties. It's close contacts and people having many contacts. So you might have a workplace contact and then home contacts. So it's the close contacts each individual person is dealing with, and it seems to be higher than ever before.
Hence why the push, I suppose, then on people, keeping a diary or keeping a log of the places they go and their contacts and whatnot, just to help make things easier on you and your team when you have to do the follow-up.
exactly. So we're asking them for all of their close contacts, and, you know, we're saying 15 minutes, depending on the contact. If someone sneezes on you, that's like, you know, that's a direct contact and not good. But we're using, you know, 15 minutes in close contact with not protective, you know, no mask on or within that physical space. So the spacing, even with the mask on, the spacing of our interactions are very important. So, you know, people should be aware of everything, every interaction they have and every trip they have. If they're going to the grocery store, you want them to make sure they track it, because as you know, with our public exposures, that's all based on people giving us information about their whereabouts and the types of interactions they had at those facilities. So we do need everyone's help to get this under control, and we rely very much on the case and their ability to accurately reflect where they've been and who they had contact with.
Okay, thank you so much.
So before we go on to the second round of question, I want to get back to Bob's question. So Bob, my team just sent me a link, and we do have safety guidance for holiday donations in Windsor-Essex. So if you go on our website, it does provide the guidance for the community members, how to prepare items for donation, and then what to do after you donate, and guidance for the organizer, employers, and volunteers of charities and organizations. So all those guidance are already available on our website. And if you can't find it, please connect with Mike, and maybe we can send you the link.
Oh, that's awesome. Okay, great. Thanks. Yeah, I'll hit Mike up after the meeting then. Thank you.
Any further questions from CBC?
Yes. I believe that tomorrow it's going to be 2 weeks since Bagley was closed. I know that the school is closed until further notice, but I'm just wondering, the students that would have gotten sick, wouldn't they have gotten sick by now, since technically like their 2 weeks kind of are up? So shouldn't they be allowed to go back, at least the ones that aren't sick right now?
So I'll start, and then I'll see if Teresa wants to add more. So basically, yeah, that's a good question in terms of the return to school. So we are not only looking at anyone who is who could have developed a symptom at this time. So our team will be doing a discharge follow-up with all the as many cases as possible. But also, I think we need to work with our school board to see what the safe return to school policy looks like for all these cases. So there are a lot of work that's been happening right now with the school board to make it all happen, and agree that we don't have we haven't given when they're returning to school, but the plan is to send them back to school in a timely manner. Either obviously, I don't think that they'll all be going at the same time. There may be some staggered entry to the school, but that plan is currently being worked on. I don't know, Teresa, if you want to add more.
No, that's accurate. We're working with the school and the school boards about a return to school, and I'm looking at the dates, and it'll be based on our most current information. But I think those plans are still evolving, and like Dr. Ahmed said, there'll probably be incremental return and not the whole school returning.
Okay, so for any students at this time who have not developed symptoms, are they kind of out of that self-isolation period? Because I know before they were supposed to isolate and stay at home.
So some of that requires some follow-up, and generally speaking, yes, they should be out of isolation if they haven't developed the disease. But when we're talking about the return of school policy, we obviously we don't want to miss anyone who may have developed a symptom, or maybe the symptoms are mild and they're still returning to the school. So all our return to school policy is taking that fact into consideration and to provide appropriate guidance. So that's why I think it's important to stay in isolation until you're told otherwise. But you will hear some more, I guess, concrete directions in the next couple of days.
Okay, thank you.
Any further questions from Blackburn?
Yes, can you just mention about, why you send out those exposure notices because of, where people have gone? Have you ever linked cases back to someone just, being in a store and have after that exposure? I know because those are all usually low risk exposures. Have there ever been any links back to any of these exposure sites?
So, Maureen, as you rightly identified, most of these exposures are low-risk exposure, and I guess it was almost, I don't know, it just seems like a blur, the timeline, but maybe a couple of months ago when we started disclosing that information. It's in the interest of sharing more information for the purpose of transparency, so people can recognize their risks and also to make decision to go for testing. We haven't specifically linked any of these cases to the exposure, but we also recognize that not everyone remembers that. Not everyone go to the website to go through the exposure notifications and identify themselves if they have visited the facility. So it's a challenge in these type of situation, and that's why we cannot link these cases with these type of exposure. But that doesn't mean that the exposure never happened or there is no risk. It's all about getting the right information from the people. If we are getting accurate information, we will be in a much better position to pinpoint and say exactly where all these things are happening. And in the absence of that information, we go with the science part of it, that how disease is spread and what kind of precautions, what kind of measures that we need to put in place from the control and containment perspective. So we follow that. But at this point, I don't think that we have linked anything specific to these exposure notifications.
Thank you.
Any questions from the Windsor Star?
Yes, under the red category, there is the 5-person indoor social gathering limit. Just for clarification, say a household already has 5 family members living in it. How many more people would be allowed to come and say gather with one of those family members? Should they want to invite people over, recognizing that your guidance says people should only stick to their own household?
Well, generally, if you have a household that's more than 5, then obviously you are meeting that restriction limit. But we also recognize that there may be some issues or some instances where you have a family member who needs some support that cannot be arranged by not being there in person. And but we don't want that to happen on a regular basis. So finding that right balance, I think it's critical. But from the regulation perspective, that's the limit that's been identified in the regulation. So we really hope that people follow that. And in the instances when you only have someone that needs some personal care, we'll have to remember that, and we'll have to try to be respectful and use that very carefully.
So if you have a household with 5 people in it, you've reached that limit, you shouldn't have more people over, but it sounds like if there are some sort of extraordinary circumstances, then people wouldn't necessarily be fined for having a relative over who really needs that support, that kind of thing?
Well, yeah, and I think that's where some of these judgment and enforcement comes in. But obviously, we don't want to open that door for people to use it and exploit it for any reason. I think people should be very careful and respectful, and this is a difficult time. As we know, this is a pandemic. There's a lot going on, especially with people when they're looking for any of these support. So I don't think that there are many. But if that happens, I think we'll have to be very careful in how we are enforcing that regulations. But generally speaking, yeah, they should not have anyone over.
Okay, thank you.
Any further questions from CTV?
No, I'm good today. Thank you.
AMA 100?
No, thank you for your time today.
Thank you, everyone.
Thank you.